Many years ago we did commission and completed the African American Utilization Report. But what that document helped to reveal to the community and to us concretely what we all knew was that African Americans, particularly in Alameda County, are served, most certainly, but are overly served and are overly represented in many different service modalities, whether it's diagnostically, the numbers of individuals incarcerated, and the individuals that are relegated to treatment that's long-term. And so that was coined inappropriately served.
We need to establish the idea and the philosophy of the restoration of wellness for the African American community without compromise.
There are no urban area where there was a large, significant black population had ever took time to look at how African Americans utilize the different health services, and especially mental health and substance abuse services.
There was never an integrated African American service center.
Started with community outreach, coming to the county, coming to behavioral health care from the community, saying this population is underserved.
We spent a lot of time as the county listening to people first and foremost. Dr. Wade Nobles and the members of the African American mental health groups.
Many different people and experts and voices contributed, but I think I have to give honor to essentially the African American Steering Committee, and through the support and leadership primarily of Dr. Nobles, Dr. Boyles, and Dr. Goddard.
When we looked at those organizations that were providing services to the African American community, it was never culturally congruent, responsive services that were being provided.
The whole idea of having the hub comes out of decades and decades of inequities. It's high time that we recognize the African American community in a intersectional way, in the ways that they need to be supported and upheld in their mental health and well-being.
The idea of having a hub, an edifice, a building that reeks with the idea of wellness, that the presence of it alone is going to be helpful in the restoration of wellness.
It's an actual building that is inspiring.
Having an official location that everyone knows you can go to meet and approach all of your issues and challenges around mental wellness, I think is critical.
The barriers of access, to understand why the social determinants of health are important. So this is a place where hopefully all those things can be addressed.
But when we start talking about mental health and behavioral health for African American community, the one thing that cannot be compromised is the utilization of the science of black psychology. And the other thing that cannot be compromised is to look at how you apply the best thinking of the wisdom traditions out of our culture. Alameda County really is going to be able to stand up and say to the whole nation, here's how it should be done.
This hub is going to be a unique program and service that's not duplicated anywhere.
So I'm particularly excited about the ways in which the African American Wellness Hub will speak to the depth and breadth of our experiences as African Americans. You know, we are not a monolith. Within the African American community, there is so much diversity and different types of lived experiences. And to have an environment that speaks to that intersectionality, you know, the ranges in which we love and our relationships and our faith perspectives, I really look forward to seeing the ways in which all of that is reflected back to us and celebrated.
I see an oasis, and I walk into that oasis and I take a cool drink of water. That's what the hub is going to be in 2024. It's going to be an oasis where we can walk in and take a cool drink of restorative water.
It is an important task and well overdue to the African American and the Black community.